Euthyroid 6 syndrome. Introduction. Euthyroid 6 syndrome, ESS, also known as non-thyroidal illness syndrome, TIS, or low T3 syndrome, is a complex and often perplexing condition that challenges our understanding of thyroid function in the context of systemic illness. This video aims to delve into the intricacies of Euthyroid 6 syndrome, exploring its mechanisms, clinical implications, and the controversies surrounding its diagnosis and management. Understanding thyroid function. To comprehend ESS, it's essential to grasp the normal functioning of the thyroid gland. The thyroid, a butterfly-shaped gland situated in the neck, plays a pivotal role in regulating metabolism through the synthesis and secretion of thyroid hormones, thyroxine, T4, and triiodothyronine, T3. These hormones exert influence over various physiological processes, including energy metabolism, temperature regulation, and cardiovascular function. Euthyroid 6 syndrome unveiled. Contrary to its name, Euthyroid 6 syndrome does not involve abnormal thyroid hormone levels typically associated with thyroid disorders. Instead, it manifests as alterations in thyroid function tests without an underlying primary thyroid pathology. During acute illness or severe systemic conditions, a cascade of changes occurs in the thyroid hormone levels. Notably, there is a decrease in T3 levels, while reverse T3, RT3, levels may rise. T4 levels may also be affected, with alterations in the peripheral conversion of T4 to the more active T3. Mechanisms and pathophysiology. The exact mechanisms underlying ESS remain a subject of ongoing research and debate. Several factors contribute to the alterations in thyroid hormone levels during illness. These include changes in thyroid hormone transport proteins, alterations in deiodinase activity, cytokine-mediated effects on the hypothalamic pituitary thyroid axis, and impaired conversion of T4 to T3 in peripheral tissues. The intricate interplay of these factors reflects the body's adaptive response to stress and systemic illness. Clinical implications. ESS is often encountered in critically ill patients, those with severe infections, trauma, or other systemic diseases. The clinical implications of Euthyroid 6 syndrome can be profound, influencing the course of the underlying illness and complicating diagnostic and therapeutic decisions. The altered thyroid hormone levels are believed to reflect the body's attempt to conserve energy and resources during periods of stress, prioritizing vital functions over metabolic activities. Controversies in diagnosis and management. Diagnosing ESS poses a challenge due to the absence of specific criteria, and the condition often resolves as the underlying illness is treated. This raises questions about the necessity and timing of interventions in the context of Euthyroid 6 syndrome. Furthermore, controversies exist regarding the optimal management approach, with some advocating for thyroid hormone replacement in certain cases, while others emphasize a more conservative approach. Conclusion. Euthyroid 6 syndrome stands as a fascinating and intricate aspect of thyroid physiology, shedding light on the dynamic interplay between the endocrine system and systemic illness. As research continues to unravel the complexities of ESS, a more nuanced understanding of its mechanisms and clinical significance will emerge. In the realm of thyroid disorders, Euthyroid 6 syndrome serves as a reminder that thyroid function is intricately linked to the broader landscape of systemic health, prompting further exploration into the adaptive responses of the body during times of stress and illness.